You know, it's not a long video, so I'm going to cover it, but obviously I'm not in Canada. I can't speak for Canada, but I don't think that their wait times are too far off from what we experience in America. And the more I watch these videos from these people that are just trying to excuse away like their eating disorders, I should probably stop watching them because it's making me really angry. It's making me angry to see people just flatly lie, you know?
But I want to share, I'm not going to say which clinic, weight loss or bariatric clinic I go with or whatever, but I'm going to share the process with you from beginning to finish.
Yes, the deja vu is deja vuing because we have been here before. Hi guys, how are you doing today? My name is Kidney J. The J stands for jerk because my kidneys are a pair of jerks, and I am coming from you live in the Canadian, Ontario, actually, healthcare system. So I am here.
Well, I hope you get better soon, and I will subscribe to your channel, and I will like your video. I'm sorry that you're having to deal with that right now. I just had a health experience in October, so I get you.
To put my 2 cents in about what Foodie Beauty is saying. So we're going to get into her talking about her medications that she was prescribed in Kuwait. We're going to get into the wait times at the ER. We're going to get into wait times for family physicians. We're going to get into CPAP stuff. We're going to get into it all. So before I do get started, please for me, maybe give that like button a little nurse bell click. Ding, 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 ding. You know, give it a like. Subscribe if you're new. I appreciate that. Leave a comment down below. Love hearing from everyone and their experiences. As well as I do have memberships. If you want to support the channel further, I truly, truly appreciate all the current members and new members that signed up. Because I'm in a bit of a predicament right now, not sure when I can upload, if I feel well enough to upload, so that little extra bit of support really, really helps. So let's get into this. I don't even know the title. Something like, it was clickbaity, getting bariatric surgery in Canada, which, girl, you ain't getting any type of bariatric surgery in Canada at the current state you are in. She seems to think her family physician, or lack of family physician,
even like at the current state that she is, the fact that she's making absolutely no effort to take the steps necessary to qualify is going to be considered, right? So she just did a grocery haul on her live stream or whatever video the other day, and it was filled with just junk food, just crap. It was sodium filled, sugar filled, and it was not the kind of stuff that you can eat if you're trying to prepare yourself for this is a major surgery. We're talking pretty much stomach stapling at this point, and they're not gonna, if they don't see any effort involved, they're not gonna approve you for it.
Is her biggest obstacle. I'm here to tell you it's not. So let's go.
So for those of you who don't know, weight loss surgery, I think gastric sleeve and Roux-en-Y gastric bypass are covered by universal healthcare here. I'm in Ontario, Canada. Now the downfall with our healthcare system, it is universal, and the surgery is covered by that. So, the only thing is that there's a wait time. Right now, some hospital ERs have like a 20-hour. I think that's like unprecedented.
Listen to her labored breathing. Well, first of all, Chantel, they're going to evaluate you and determine whether or not you're in a life or death situation. That's what ERs do. They're not going to bring you in to diagnose you for fucking stomach stapling. Okay? They're going to find out whether or not you're on death's door and treat you. So, for example, when I've gone to the ER before for various things, whether like I needed to go in because I had like severe pneumonia or, bronchitis or, something like that, I had to sit around for fucking hours. But when my blood pressure dropped to 80/40, I was wheeled right into the back of the ER. I had tests for hours. It took from about roughly 2:30 p.m. till about 10:30 p.m. before I was admitted to a bed and kept overnight on a potassium drip. And the reason I was kept there is I wanted to go home. I literally thought I was going to go home because I had a nurse come in and he said, take these 2 drinks of potassium, bubbly, whatever it is, and you can leave. And then the doctor came in and said, no, you cannot leave. You're going to stay overnight and you're going to be on a potassium drip because your level of potassium dropped to 2.1, which is a fatal level. And if you leave, you can die. Right? That's what the ER is for, Chantel, is life or death situations. It's not for your basic health care. Okay? There are other clinics, there's urgent care, there's other places you can go to get diagnosed and referred to specialists for what you're looking for. But you should not be going to the ER for that. You're taking up space, quite a bit of space, if you don't mind me saying, for patients who are actually in need of ER services.
Accidented, like it's never been that high.
Okay, so I talked about this in my last video. I will address it again. Maybe there's one hospital in her area that is a 20-hour wait. Can happen. But we do have things called triage. So if you're coming in with chest pain, signs of a heart attack, signs of a stroke, they will treat you, assess you, they will assess you and treat you right away. If you come in with maybe a wound that...
Especially a stroke, because there is a shot, if you have a stroke, there's a shot they can give you within the first hour that will reverse the effects of that stroke. So that's going to be like the highest priority. But most hospitals prioritize things in the ABC, airway, blood, and chest pains. That's how it gets prioritized, because if you can't breathe, obviously we need to make you breathe, right? If you're bleeding all over the floor, we got to like at least do something to make sure that blood's not all over the floor, right? And if you have chest pains, you're probably having a heart attack. We need to handle that right away. But stroke is probably even higher prioritized than that, because you get about 1 hour. It's roughly 1 hour to get the shot that will reverse the effects of a stroke.
Stitches, maybe you'll be waiting there 20 hours. Could be possible. Just to let you know, I was in the ER 2.5 weeks ago. Walked in around 9-10 a.m., had a CT, had an x-ray, had a diagnosis, had surgery the next day. Now, if you're waiting for a bed, you might have to wait 20 hours. Absolutely. Yeah, so she keeps citing this 20-hour wait time, which is unprecedented and probably not true.
But the weight loss surgery, I think it's could be about a good year and a half, maybe 2 years. It just depends, because each step you have some testing you have to do, and I don't know. I might be able to skip the sleep study one because I have sleep apnea and I've been having it treated with the CPAP.
I'm going to disagree. He has not been actively following up on any of the CPAP stuff. It is recommended you actually replace your CPAP machine every 5 years, as well as if there's any changes in your weight, in your sleeping patterns. They suggest another sleep study so they can recalibrate your settings on your machine. Not to mention, you're supposed to be watching the hosing and all that stuff at least weekly. I shudder to think what's inside Foodie Beauty's CPAP. I don't know. There might be like ground zero for the next pandemic in that thing. And then she also talks about all these steps she has to do along the way, like for testing. It's solely on her, though. She has to keep up with whatever recommendations they give her. By the way, she's not getting this because she would not be eligible right now anyway, so it's
new. Of course, and one of the criteria, I should say, that you...
And apparently the reason that she's not eligible right now is because she stopped paying her taxes in Canada. So she has to pay some back taxes before she even qualifies. And I've heard numbers upwards of $60,000 worth of back taxes. I don't know what's true there. She also has lied about how quickly she could actually get in with a general practitioner. I looked this up on Google, and it said the average wait time to get in with, just for like a physical, right, in Canada, is about 27 weeks. That is not 2 to 3 years, Chantel.
You need to meet in order to get weight loss surgery is you need to be referred, right, by a physician, your family physician specifically. They request who will be following you throughout this journey. You know, you need a physician to monitor things, whatever, medical stuff. But I don't have one. Mine that I had moved to another country. I don't even know where. So,
yours who you had when? I mean, like, that doesn't even matter anymore. Obviously, you've just moved back to the country, so you have to reset all of this up. So have you made the phone calls, Chantel? Have you set your first physical appointment so that you can get in there? Have you maybe, rather than try to get into the ER, looked into local clinics or an urgent care to talk to them about your blood sugar problem that you supposedly have with your monitor that never has the date set correctly? Okay.
Since then, I haven't had one, and the wait list for some places is 2 to 3 years. It's anyone from Canada will, at least in Ontario, you will know how hard it is to get a family physician.
Right.
Okay, so it's just hilarious to me that she thinks right now her biggest obstacle for getting a referral to weight loss surgery is a family physician. If you check out Sansa Talk, she goes over, all you have to do is look over, do a Google search for the criteria. Untreated BED, no go. Untreated diabetes, no go. It's just, Foodie has everything very backwards. She needs her family physician, first of all, to get her uncontrolled diabetes under control, for recommendations for mental health. She also needs to get her non-alcoholic fatty liver disease taken care of, her enlarged heart, her medications refilled and constantly refilled and taken again, and refilled and taken again. It's just madness to me. It really is. And I've also addressed the physician wait time. I know Foodie Beauty has burned a lot of bridges. I know the thrombosis clinic dropped her. I do believe the family doctor did move away. I actually had a family doctor that decided to give up their practice, and they referred us to another family physician. That would have happened in Foodie Beauty's case if she had followed up and really advocated for herself and said, I can't be left here without a family physician. I need someone to monitor me.
Well, and on top of it, she has family there, right? She has family in Canada who have family physicians. She can get a referral from one of her family members, say, hey, my family physician has moved out of the country. I'm trying to find somebody else I can go to, blah, 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 right? Why is this so difficult for you? Like, you're just full of excuses.
In the future. So she could also go to a walk-in clinic and have a physician out of there.
I need to do is first get referred. So I'm going to clinics, middle of the day, probably not a smart idea as I found out today. Different clinics, usually full, too long of a wait. Like,
If you haven't tried out this wire-free...
I really want to know what too long of a wait is in foodie beauty time. Yeah, it's best to get to a clinic earlier in the morning. People are lined up outside. They go in, they get served, get seen by the doctor. I don't know why she wouldn't go just during the middle of the day, because during the middle of the day, at least you don't have to wait in line. You can walk in, they say, what are you here for? Okay, it will be a 2-hour wait. She could sit her ass down, do a TikTok, do a cameo. I don't see the problem here, except it's the foodie beauty instant gratification syndrome, as always. Let's not.
Yeah, she could literally like play Sudoku or something on her phone. I mean, seriously, it's 2 hours. Bring a book with you. I don't think these people read.
Forget this woman has made and dipped on countless appointments. One time she made an appointment for a blood draw to come to her home, taking someone else's spot, taking that nurse from someone else who was housebound that could not leave their home to get blood drawn. And she didn't open the door for them. So, I don't know, just shut up, I guess. Go to the clinic, wait, get your doctor, start with the diabetes, because that's what they're going to start with. The recommendation, you could ask them for the weight loss surgery, but it's not happening for a while, sister.
basically, I need to go very early. That's why you see people lining up at the door of clinics in the morning. That's probably the smart thing to do.
No, you just need to get off your ass, go there, and wait. Be an adult. It's not that hard.
Yeah.
And that's something I need to do as well. But I'm going to keep trying tomorrow. Tomorrow I think is weekend. So maybe Monday I will stand in line very quickly. Now the holidays are coming, so I don't know how far I'll get. So now I know that people are like, some people are just like saying that I made derogatory comments before about the surgery. So some things that people are saying I said, I need proof of that because I don't remember I remember maybe having an opinion about it and saying, I don't remember saying people are weak if they can't do it because I feel like I'm weak. I don't feel like I'm strong. I felt weak that if I ever had to get weight loss surgery, I feel like defeated because I have to resort to that. The thing is I still feel that way a little.
Okay, see Cuba Rage if you want to see her talking about weight loss surgery and how it's a weakness if you can't do it on your own. I'm going to Missy Elliott this bitch and flip it and reverse it. She is too weak to even get the referral. She is too weak even to sit in a clinic to get a doctor to treat her for diabetes because she is too weak. And I don't mean this physically. It's a mental thing, obviously, which she needs to take care of on her own with therapy. She's too
Flip it and reverse it.
weak to get the surgery, which says a lot.
This week coming, I have a lot of dealing with my mental health. That will be the next step. I itemized what I need to do here, and it's so much.
Leave a comment down below what you think Foodie Beauty's itemized list looks like. Top of the list, fried chicken. What was that? Chicken tenders and all that crap she ate. Top of the list.
I don't know. Wish me luck. And I wish you guys luck too if you're going through any of these kind of things.
Oh, I am definitely going through it right now. But you know what? I understand it's a two-way street. I can't just sit on my ass and expect to be healed, expect everything like that.
I'll try to go to all the appointments and just like do what I gotta do. I'll just keep you updated on all the health things, because
Dude, if you lost some weight, you'd be able to breathe. You know that? It's not just I can't breathe at night and I have sleep apnea, right, Chantel? You can't breathe during the day. Listen to you just doing a video. You can't breathe in the middle of the goddamn day.
I have my papers here. My purse. I brought my papers with me. Brought my papers along from Kuwait with my diagnosis. It says diagnosis, diabetes, because my A1C was, what was it, 11? I think, or 10, or I think it was 10. Or maybe 11, I don't know. I forget. It's on the paper. So that I can have my diabetes controlled here as well, So I'm going to have them review the medication because I think I have more access to better diabetes medication here, If you guys are on anything that you would suggest, something that's not, going to hurt my tummy, like...
In other words, what's something that won't affect my insatiable appetite, my, drug of choice of getting into my system? What will make me feel that I can just still eat as much as I want? Now, I'm done with this, by the way, so this is me wrapping it up. She talks about her bringing her paperwork. That's all well and good. Our doctors here will start from scratch. They will redo her A1C, random glucose, all of her kidney function tests. They will do all that blood work starting from the ground up. She talks about the Ozempic shortage. She was on Ozempic and she just fucked off with it and chose Coke. Whatever, happens every day. Just so people know, we do have the Ozempic shortage, but it's not as prolific here in Canada as it is in the U.S. The U.S. actually has the FDA regulations where it can be prescribed off-label for weight loss. Here it's only prescribed for type 2 diabetes and controlling your blood sugar and maybe losing a little bit of weight.
Well, and also because we've had a bunch of celebrities taking advantage of it and abusing the supply chain, right? I mean, that's what I saw on the news, is that because it's supposed to be a drug for diabetes, but in America, in the U.S., a lot of celebrities are trying to take this to drop some weight. And it's like, come on, you're not all that fat to begin with. Give me a break. Like, there's people with real health problems, and you're buying up the supply.
That way. Yeah, sure. Try to get better meds than metformin. Metformin is the standard here for diabetes. Anyways, guys, if you made it this far, I appreciate you so much. And yeah.
Nice video. Well done, Kidney J.